Hello, my name is Ron Bowie, and welcome to The Informaticist. So this video is the first in a series that will cover and hopefully help you prepare for the RHIA exam. And this video will cover the first domain, first task, that is task A1 from the content outline, which is to code diagnoses and procedures according to established guidelines. So while there are many ontological systems and terminology and coding systems within healthcare, I'm pretty sure this is referring to primarily payer-oriented systems, and in practicality, at least I've yet to hear of anyone getting something else where they really have to code for it. I think this is really only going to test you on the ICD-10-CM, PCS, and the CPT coding system. If you've encountered any from outside of that, if you've taken the RHA and encountered any outside of those that are coding questions, please tell me, and we can amend this. But at present, I'm pretty sure that's all we're going to talk about. Now, what I really want you to understand for this kind of tutorial is that the way that they're going to ask these questions on the RHIA exam is not really as a coding question. Now remember, you're not going to be bringing coding manuals. You're not really even expected to have done extensive coding practice, frankly. That is, an HIM program could be an accredited, CAHIM accredited HIM program with how many hours? I'm forgetting the hours, but it amounts to one course in coding. So don't go into this thinking, oh, I need to have memorized everything, like all of the different rules for the different chapters in CPT, or all of the different rules for the different chapters in the ICD-10-CM. No, not at all. In fact, what I want you to really understand is that's not what they're testing you on. What this is really going to be is kind of a 30,000-foot level knowledge of these coding systems, but actually a pretty tricky test at times, not all the time, but at times, of your medical terminology and reading comprehension skills. And if you spend your efforts making sure you are really sharp on your medical terminology and you are attentive and analytical reader, you will actually do quite well on these questions. And I doubt you'll miss any, maybe one of the 5 or so you'll get simply from not knowing coding. That is to say, someone with no coding knowledge will get most, if not all, of their coding questions right on the RHA. I'm pretty sure about this. And if you've encountered one that really required you to dig through lots and lots of coding knowledge out of your head, please do tell me. And if you can remember the question, maybe we can secretly talk about that. But I actually tried to pay attention to this because it was a curiosity of mine, and I didn't see any except for one that my knowledge of coding saved me the right answer, and I suspect that's pretty much going to be a mean, even though that isn't good science, but I suspect that based on the training provided. So in your Latour, in the 4th edition Health Information Management book, which is by Latour, this is going to be from the first 10 pages of chapter 15, which is to say it's not going to be that useful. If you want to read textual things to help you, outside of taking my advice of reading your terminology text, and get a good one, and if you're going to use a terminology text, get one that really has like a section on general how words are constructed, and then a section on physiology, anatomy, and a section on pathophysiology and diseases, and then a section on procedures, interventions. Get one that really goes into each of those. That's the way you want to study medical terminology to get these really well. But frankly, you probably don't want to do that at this point. So I would say if you've done well in your medical terminology course, go with it. If you haven't, I would suggest you review, because I'm pretty sure that's what's going to cost you on this test. Now, that said, if you really do want to read about coding, it is going to be like a 30,000-foot level. So there are free, the coding manuals for all 3 of those systems are free. You can, I believe, get all of them from CMS's website and just download it, and they're like 100, 180 pages. Don't read all that. Read about the first 10 or 15 pages. That is 30,000 foot. The first 10, 15 pages of the ICD-10 PCS will go through how it's structured and how the way that they're using the meaning of words for the different parts of each code. Similarly for the ICD-10-CM, it'll tell you how it's structured and like the way its hierarchy works. And for the CPT, very similarly, that's what you'll get. And that's really what you need to know. But I suspect you know that. If you've done any amount of coding and you passed your class, you've gotten that ingrained into you, I hope. So I don't think you need to go back. But feel free, please, review. Get it in there. And don't drill anything more. I think you'd be wasting your time to go much further. And kind of to make that point, I do encourage you to get this book. So let me move the camera a bit. This book is the Registered Health Information Administrator RHIA exam prep book, and or exam preparation text. And it's by AHIMA, and this is the 5th edition I have, so that's what your page numbers are going to be from. But any edition should work. And I suspect there's not going to be a big difference in the types of questions given, because I don't think the test is going to change anytime soon on this matter. But I suggest you get this book, if for no other reason, because it really has representative questions, and in particular, it might be the only place, it's definitely the only place I've seen that has questions that really represent how the coding questions will be on the exam. So if you're concerned about that, get it. If you're concerned about anything in this test, about how it might be structured, get this. It's really good. I do a short book review on this and talk about the structure of this textbook, but I would strongly encourage you to use it. It's a great confidence builder. If you score well on this, you will probably score well on the exam. So we're going to use this. I want to run through a few coding examples, and hopefully we'll have time. And what I really want you to understand here is how a good strategy will make it faster. So I'm going to teach you a strategy that I think works really well and will save your brain power on this and let you kind of go through it with the least amount of turning your wheels. But also how these are really reading comprehension questions. They're really going to rely on your general knowledge of medicine, and they're really going to require you to think well about what you're reading and deeply about what you're reading, not about coding systems. So in this first one, this is question 22 on page 6, and it is a CPT coding question, and you should immediately be able to see that. Now, what I want you to do, the first thing you should do with any of these questions is just spend 5 to 10 seconds and read the paragraph. Now, I'm going to abridge this, but basically a patient was admitted to the ED. They had 2 lacerations and a broken ankle. They received, and you know that this is a CPT question, so when you're doing this 5 to 10 second read, you're going to look for the procedures. So the procedures, they received an x-ray of the ankle, showed a bimalleolar ankle fracture requiring closed manipulative reduction and simple suturing of the arm laceration and layer closure of the scalp, period. Provide CPT codes, blah, blah, blah. Okay, so read that, kind of know where everything is in here, because you're going to be looking at it again, but you're not trying to memorize it. You're not going to start coding it in your head. Don't do any of that. Just read it, know where the content is. In this case, especially know where the procedures are mentioned. Then they're going to give you a code bank, so you're going to look at your code bank. Don't start coding yet. You're going to look at your code bank, and really what you're going to look for are how these codes are similar and different from each other, and you're going to form them into groups. So now we're just going to read and comprehend our codes as pieces of categorizing systems, as information that needs to be grouped together. And so here we have 12002, simple repair of superficial wounds of scalp, neck, axilla, external genitalia, trunk, and or extremities, including hands and feet, 2.6 centimeters to 7.5 centimeters. 12004, simple repair of superficial wounds, etc., 7.6 centimeters to 12.5. So both of these are simple repair of superficial wounds, but one is shorter, one is longer. Third, 12032, repair intermediate wounds of scalp, etc., 2.6 centimeter to 7.5 centimeter. So this is a short length, but it is an intermediate wound. Now these 3 are all 3 for the repair of wounds. And so you can think of them, okay, I have 3 repair of wound questions, and what they're going to ask is the length. So 1 is long, 2 are shorter, but then again, 2 are simple and 1 is intermediate. That's what you want to look for. You want to group them like this so, to understand what are the questions that are intrinsic to that structure or to the codes that they give you. And the last 2 codes are closed treatment of bimalleolar ankle fracture, etc., 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 with manipulation, and then 27818, closed treatment of trimalleolar ankle fracture with manipulation. So what are they going to ask you? Is it bimalleolar ankle fracture or trimalleolar ankle fracture? Now, that's all you're going to think at this point. That should take you 5 to 10 seconds. Then you look at your answers, and in your answer section, this is where you actually then start doing your, reasoning and think logically and deductively. So this is when you turn your wheels a bit. But by having grouped your codes together, you've already kind of preempted what, you've done the work necessary to use these codes. And what I want you to see is, because you start thinking with this most specific bit of information, you actually are giving your brain the least work. This is the most specific piece, the choices you get to use as answers, and you always want to work from the most, when you start working hard, you want to work from the most specific piece to the most general. And so this is what you're going to do. You look at your codes and look at how your codes are actually asking the questions that you saw might be asked from the groups of codes that you in your code bank. So in your answers, you always read these codes left to right. And what I would always suggest is just looking at the first set of codes. And in this case, in CM, of course, the first code is your primary diagnosis, and it can matter a lot. But in CPT, you're probably always going to get the same set of the first code anyway, in part because they're not testing you on the order on those. So what you, at least didn't see that maybe. Anyway, so here you see they're really going to straight up ask you bimalleolar ankle fracture or trimalleolar ankle fracture. So 27810 or 27818, and those are really your choices. And so you're going to eliminate answer B because it suggests 27818, and in this description, as I read, it is a bimalleolar ankle fracture. So done. You now know A, C, or D, and now you're going to be choosing amongst the types of repair. Don't think broadly. Really look at what they give you. In A, they tell you 12032. That is the repair intermediate wounds of scalp with 2.6 to 7.5. And now again, this is without knowing anything about how to code for repairs of injuries in CPT. And what you know is they already said in here a simple, what was it? I'm sorry, I wanted to use the exact language. But a simple suturing of the arm laceration. So this is only giving you the option of the intermediate repair. You would ignore that just from reading comprehension. Now, C, which is actually the correct answer, will give you 12032, your intermediate repair, and 12002, the shorter of these simple repairs. Now, again, without knowing anything about coding repairs in CPT, or this type like cuts in CPT, you would immediately see, okay, they're giving me my intermediate and they're giving me my simple, and you knew you needed a simple, but again, why would you need an intermediate? If you understand medical terminology or if you understand medical procedures, you know what a layer closure is. And really, I hope at this point, simple logic would really tell you, or just your intuition or an understanding of medicine would tell you a layer closure is not simple. If there's something such as a simple closure, something you could put a band-aid, glue, or a really simple suture on, and like 1 or 2 stitches and close, that's not a layer closure. A layer closure involves aligning the tissues. If you know what a layer closure is, you know this is another level. There's something beyond just putting a band-aid on it. There's something beyond taping it together. And so when you know that, and you know that that is what a layer closure is that next step up. It's when you're aligning tissues and you have to do each layer together to make sure that you have a good alignment and no terrible, ugly scarring. Okay, that must be the intermediate wounds. And just from reading comprehension, you realize I'm going to need that intermediate wound code. And okay, they're also giving me my simple code. And it says here in the language, simple suturing. Now, this is actually one of the things that they kind of do to trick you. They will use different language, and completely accurate language, in the case that is not the language used in the code bank. So you do need to know where these synonyms are and apply that. And we're going to see that in more detail in the next one, where your knowledge of language is really what's going to matter. But here, so you would know, okay, the correct answer is C. And just for completion, answer D gives you 12004, which is the simple repair of superficial wounds, but it's the longer one. Now here's where you could get yourself in trouble. If you don't know language, so you don't really know that a layer closure is not a simple wound, it's actually an intermediate wound, then you would think, but let's say, okay, you do know the CPT system and you know that wounds of the same type are all added together. So you would say, oh, okay, they had a 3 centimeter simple suturing of the arm and a 5 centimeter layer closure. I must be supposed to add those together. That would be 8 centimeters. So of course this is the correct answer. It's between 7.6 and 12.5 centimeters of simple repair. And you'd be absolutely wrong because a layer closure is not a simple repair. you will be wrong if you know CPT but do not know medical terminology. If you know medical terminology and don't know CPT, you would get this correct. And the real test is like this. So let's look at another example. And I can't zoom out because my camera's not great. So here we go. Question 24, it's on the facing page, page 7, says a patient, and sorry, this is an ICD-10 PCS. So when you first look at these, do think of that. So, okay, we're going to code a procedure. So a patient has malnutrition of malunion of an intertrochanteric fracture of the right hip that is treated with a proximal femoral osteotomy by incision. What is the correct ICD-10 PCS code? Now, I do want to say this is a 1-sentence long case, and that's a little short. The other one was about 6 sentences, and it was too long. My experience was most of the cases were about 3 or 4 sentences long, so just a heads up on that. But here, with the PCS system, it's great because you're just going to be asked to choose one code, and I don't think that'll ever be different. And also, you are, and if I'm wrong, be wary of that, but I didn't get one like that, and I haven't heard of anyone else. But also, because the PCS codes are so hierarchical, you can actually simplify again. Don't start thinking till you work from the simplest, or till you're working from the simplest area. You can actually do that from the code. So when you look at the code bank that they give you, start from the most specific, the simplest part, which is from the right. So you would look at the right and say, oh, okay, these are all the same, no qualifier in the qualifier section. And device, oh, all the devices are the same, no device. Approach, all the approaches are the same, open. They're not going to ask you anything there, obviously. Body part, you see upper femur right, hip joint right, hip joint right. Ah, okay. So that is a question they're going to ask. Is it going to be upper femur right or hip joint right? And whichever one you choose is going to eliminate half of your options. Again, because you're choosing one, you can do this from the code bank. But the other ones where you have to choose multiple codes, I don't recommend doing that. But when you're looking at the code bank here, so when you're looking at the code bank, you can then see, okay, we have to choose one of these 2 pairs, and then you're going to look at your root operation. In each pair, in the first pair, you can choose either excision or division, and in the second pair, excision or release. Now, if you know everything about the PCS system, you will know what they mean by excision, division, and release. And in fact, you will, if you read one of the guides from CMS on the PCS system, they actually use osteotomy as an example for one of these categories. So that would be one way to know the answer. If you happen to remember the exact page from the exact document, it's actually from their, they have a shorter, like 12-page document about the PCS system that is actually just about this terminology and to correct confusion. And you'd remember that. No, but you don't need to do that if you know your terminology. So it's another way to do that. But I really recommend you know your terminology. And frankly, as a career choice, it's probably going to be better for you all around, unless you are a coder and want to do CDI and all that. But a patient has a malunion of an intertrochanteric fracture. If you know what a malunion is, you probably have a good idea what's happening here. Similarly, if you know what an osteotomy is, you have a good idea what's happening here. So an osteotomy is almost never an excision. In fact, I'm not sure it ever is. I know that with a cuboidal osteotomy, I believe it's the right one, you might be removing a piece, like you cut off a piece of the bone and remove it. But other than that, an osteotomy, even if you fully cut off a bone, it's normally for the purpose of reattaching it, whereas an excision is true removal, throw it in the trash bin. And so this is not an excision. Now, similarly, if you understand just from reading comprehension and the general purpose of the PCS system, you aren't coding where the fracture was. You're coding the procedure, and the procedure was a proximal femoral osteotomy. So you know from the body part, you're not going to code the hip joint right. You're going to code the upper femur right. And I probably should have said that first as we're working from right to left. But once you've decided that it's upper femur right, you're choosing between excision and division. And again, if you know what an osteotomy is, you could take a good guess that it's not an excision. If you don't know, then you might be confused at this point, because you're looking, well, I guess excision, I guess division, you wouldn't know. But if you know what an osteotomy is, you know what an otomy is. You should have a good idea that this is a division. Osteotomy is normally where you're cutting a bone and separating it from another or from itself, and that might be to reattach it, and in this case it's corrective. So this malunion is where they had broken their hip and it healed incorrectly, so they're actually separating it so that they can probably realign it correctly and have it heal the correct way. And of course, with this type of question, you're actually only choosing one code, so you would choose answer B, which is going to be the division of the lower or the upper femur right. Now, I do have one more question in here. We can talk about this. It's an ICD-10 CM question. Oh, I'm sorry. Yeah, CM question. And I guess we have a few minutes. Let's see if we can get through this. But again, the point of all this really is that your reading comprehension, your medical terminology are what are going to pull you through. And I'll tell you, when I took the test, I had one question that the reason I didn't get it right was because I wasn't sure if that procedure included an endoscope or not. And I narrowed it down to 2 PCS codes and just couldn't choose, because it was basically, do I choose the one that included the endoscope? And it wasn't like I needed to know anything else about this procedure, even though the codes were different in other ways. What really would have helped was knowing if that procedure included an endoscope. And that's the level of knowledge of a procedure that you probably could get away with spending more time in just medicine in general, or reading your medical terminology, or check out a nursing book on procedures, getting more involved, essentially, being more enculturated. So that was the only one that I think I might have gotten wrong. I took a guess, but I don't know. I still don't know if I got that right. And again, knowing more about coding wouldn't have helped me at all. It really was just reading comprehension. So here we have, for our last question, so I think I've made the point. I hope so, because the video is going to end real soon. So, and feel free to comment if you need anything else. We're going to try to end on this last one. This is question 35 on page 84. So this is the practice question section in domain 1 still. So a 65-year-old woman was admitted to the hospital. She was diagnosed with sepsis secondary to methicillin susceptible staphylococcus aureus and abdominal pain secondary to diverticulitis of the colon. What is the correct code assignment? Now, right off the bat, you can see in these codes, they're giving you 3 codes that are all just the sepsis codes, so A41 dot whatever, and so those are a group. And then kind of in that group is the B9561, methicillin susceptible staphylococcus aureus infection as the cause of disease classified elsewhere. And then there is the code K57.32, diverticulitis of large intestine without perforation or abscess without bleeding, and then R10.9, unspecified abdominal pain. So in this question, or in this code bank, you should see, okay, we kind of have 4 infection ones, and in particular 3 are sepsis. Then they have this methicillin susceptible staphylococcus aureus infection as the cause of disease classified elsewhere. So that's kind of separate from that. But these are a group of 4 and then a group of 3 and 1. And then we have these 2 really, the diverticulitis and the unspecified abdominal pain, really, okay, how do you want to code this abdominal pain? And while abdominal pain was mentioned, again, if you understand your medical terminology, understand reading comprehension, you'll see that these are both secondary. So without going that though, first, let's look at our code. So we're going to work from our most specific bit, and in here we'll see, okay, for these, and remember in CM the order matters, and the first thing to be your primary diagnosis, and what they're telling you is you are going to choose one of the sepsis. You don't even have to think about that. They're making you choose between 41, or really all of these, the 41.01, A41.89, or A41.9. And frankly, whichever one of these you choose, you're going to eliminate 2 or 3 other answers, immediately getting an answer or getting very close to it. And so your choices are sepsis due to methicillin susceptible staphylococcus, or other specified sepsis or sepsis in specified organism. Now again, going back to the case, reading comprehension, she was diagnosed with sepsis secondary to methicillin susceptible staphylococcus aureus. If you understand secondary to, you know your answer. Because the secondary to is telling you that this is the cause. And so you have as A41.01, sepsis due to methicillin susceptible staphylococcus aureus. And there's only one choice here that actually is your A41.1, so you end up with choice B, and you actually don't have to think any further just because you did your reading comprehension and you know what secondary means from your medical terminology. You don't have to know about coding. You would choose the only correct answer here. Now, of course, they could have been more tricky. Another one of these could have had the A41.01, and I don't want to lead you to believe that's an impossibility, but I did have a question similar to in structure to this, where it was like, oh, well, okay, it can only be this. And it was straight up just reading comprehension. Now, okay, let's say you did have to think a little further. Well, again, you know what your other code for the abdominal pain or diverticulitis out of that group should be. And again, by grouping them, you kind of know the questions they're going to ask from here. That if you know secondary, so the abdominal pain was secondary to diverticulitis of the colon, okay, you know it's K57.32. So you would only choose the one that only has that one. So I hope this helps make the point. But also, this is a good book. You want to get it, the Registered Health Information Administrator Exam Prep. I don't really recommend going through the AHIMA book or the Latour book on this, but you can. Again, that's 387 to 397. And on that note, I hope this was helpful. If you leave any comments you need. And sorry I got cut off there near the end. And I just wanted to close by saying thanks for listening, and best of luck to all of you. Now, this was my first attempt at a tutorial video, so if there was anything that you liked, didn't like, or if you felt like I was misleading anyone, or you have an idea of how it could be improved, please give me that feedback. You can leave that in the comments below. Also, I set up an email address, and that will be in the description of this channel, so you're welcome to use it, and it'll stay there until the day it gets abused, at which point it will disappear off the face of the earth. So, again, thanks for listening, and really continue studying, study hard. I do strongly encourage you to get the RHIA exam prep book. That was really great practice. It is highly representative of the exam. That is to say, if you do well in it, you will probably do well in the exam, and if you do poorly in it, you will probably do poorly in the exam. I'm pretty sure it's the case. So on that note, thank you all, and good luck, keep learning, and continue helping to make the world a better place. All right, take care. Goodbye.